Hello and welcome to Module 3. We're going to do a quick lecture on career planning and development from your chapters 7 and 8. I posted the actual lecture notes in Module 3, but I wanted to go over a few things with you and then give you some time to do your own career exploration. And we've posted it through Salary Surfer as a resource, and you'll see that under career resources. So this week I'm going to give you some time to just kind of surf around there and get some more information that pertains directly to you and your needs. So the goals for this lecture, I just wanted to talk about the pros and cons of working as a volunteer or possibly doing an entry-level allied health profession, list advantages and disadvantages of schooling commitments and what level of commitment you want to make as far as your future career, discuss the components of the Common Core knowledge and identify which components may pose the most difficulty for students and specifically reflect on that for you. And then you're going to have time to explore your options. Let's look at the pros and cons first of possibly volunteering or choosing an entry-level allied health profession. And this may be while you're waiting to continue your education. For example, nursing. If you're following nursing and pursuing that, you probably already know that it is a very impacted career and programs are very difficult to get into. So some students do wait 1, 2, or even 3 years to get into a nursing program. So we always suggest to our students to look at their options and really build their skills. And some ways to do that is to either volunteer, which this would be for typically a non-paid position, but somewhere where you can work within the industry. For example, Mercy San Juan takes volunteers in their radiology department and they go around and do patient surveys and things, but they get to be in the hospital and, looking and working. Kaiser also has volunteer programs. So that's one option. Another option is that you look at a career that maybe takes 1 or 2 semesters or even up to a year that has a higher wage, has experience, typically includes benefits, and really helps you to get that core experience, as well as it can help you on applications to nursing and medical school or PA school, whatever you're looking at there. And these might be EMT, which is typically a 1-semester course. Phlebotomy is a 1-semester course typically. CNA is a 1 semester. It's actually less than 1 semester here at Sierra College. Medical assisting. There's also many other avenues if you have separate interests where you can research getting certificates or associate's degrees in areas that might interest you in allied health. And so the pros would be for this, that you're getting paid, you're getting experience, and employers oftentimes will give you educational incentives, such as the example I gave you with Sutter giving, I believe, $2,000 or $2,500 per semester. I gave you an example of that with my friend who was a nurse and did her associate's degree to bachelor's degree through American River College in Sac State. And all the while, she worked for Sutter as admissions before she got her nursing, and then as a nurse, and had her education paid for along the way. So that's a definite huge pro, as well as getting that experience and giving you a leg up if you are waiting to get into a program. Cons are it takes more time and effort and more money in order to take those programs on. But once you're done, you're actually making money instead of sitting and waiting for entry to some programs. For volunteering, I would say the biggest con is that you are working for free. The biggest pro is that you're getting exposure and access to be able to see allied professions. Looking at school commitments, I apologize. I noticed that there were 2 certifications there, but many people get multiple certifications, so that may have been in my head. But when you're thinking about schooling, what works for you? Are you looking for something that requires an associate's degree, or do you want to move on to the bachelor's or even the graduate? degrees. So when you're doing your research, you want to look at that. What is your commitment? And is there licensure involved, certification involved, registry, becoming a registered nurse, for example? And what does this look like as far as your time commitment, school commitment, your costs, etc.? And really exploring, for example, some people say, okay, I'm going to start at the associates and I'm going to do an entry level. Then I'm going to work while I go to school to get my bachelor's. Then I want to become an RN, say. And then as I'm an RN, I know I want to be in a specialty, so it will require that graduate. But it's a pathway, and that's really what we're trying to show you throughout this course, is it's truly a pathway. And as you hear our guest speakers, it's not always a straight pathway, and you get so many amazing experiences along the way. And for some of you, it will be a straight pathway. We're all different, but just really thinking about what you need and what are those pros and cons and weighing them out. The Common Core of Knowledge was addressed, I believe it was in Chapter 7, and for these healthcare fields, really looking at medical terminology, anatomy, physiology, and math is involved because dosage calculations, measurements, different things that you need to be able to do. And so these core knowledge courses are very important to have that foundation and to do well and to understand. Now, that's not to say if you struggle or, like this girl here, have math anxiety, which I do, that you can't get through that. There are resources, support systems, especially at Sierra College. We have some of the best resources around for our students, but all over the community college and UC and state schools, there are resources to help you succeed. But you do need these common cores of knowledge and to really base that foundation for your future career. And then now we've figured it all out. We've gotten the schooling figured out, and we need to know what we need in the profession, right? That career development. So first and foremost, professionalism, and this has to do with your behavior, your soft skills, how you're able to communicate with people, how you are on time to work, dressed appropriately, not using inappropriate languages, and really following the policies of your employer. So for example, when you are going to work, you might be required to have your uniform clean and pressed, no facial hair, cover your tattoos, trim your nails. And these all have reasons behind them. And as you go through the programs, you will understand that. But professionalism is key to all of these allied health because you are directly or indirectly working to help people. And you will need to keep patient confidentiality, which we've read about HIPAA, Health Insurance Portability Accountability Act, but that's something that is really a part of your daily life, whether you're in administration or patient care. So it's important to know, understand, and apply that. Teamwork. You're going to continually work as a team, whether you're working directly with the patient or you're a support service to that patient or resident. So making sure that you have strong collaboration skills and ethics, really choosing those ethical issues, making sure that you are making the right choice, that you're valuing your choices, and ethics plays into it, as you read, in many different levels. So making sure that you understand and apply that to your daily life and career. And then you're always going to be looking at continuing education. It's a constant learning because everything is growing and changing. So I'm really glad we had this time today. And what I'd like you to do now is click ahead to your resources and look at Salary Surfer, go ahead and surf that web, get the information, possibly get some information for your project because we're into week 2. So hopefully you've been thinking about your personal story, about what type and choice of project that you're going to be doing. And this is a great way to utilize some of that time to also work on the project. But check some different things out, some different careers, not just that one that you're pretty sure you want to do, but some other ones that you're interested in and might just want to know, how much do they make? How long do they have to go to school? What's the outlook? Have a great day, and I look forward to seeing you online. Bye-bye.